Hey, good morning. Dr. Osar, can you hear me this morning?
I can, thank you. It's great to be
Perfect.
on. Thanks for having me.
Good morning. I'm glad to have you this morning. It's good to see you. How are things in Chicago?
Pretty much like they are anywhere. On lockdown, it's very quiet outside, but we're just trying to send some positive energy and positive education and support our communities just like you're doing. I see you all over Facebook Live. I see you, constantly spreading the good messages out there. So, we appreciate leaders like you that are out there and not spreading fear and anxiety and just feeding into that mass media. So thank you for all you do.
Yeah, thank you so much for joining me. So good morning, everybody that is on live. We've got quite a few participants joining this morning. For those of you who may not know me, my name is Jackie Bachmeyer. My husband and I own Evolution Fitness and Wellness, and we're in Houston, Texas. We serve primarily a population of folks that are 50 and better. But we're here to help whoever needs that help. Today, joining me, I have my friend, mentor, and coach, because he's worked with me in all of those capacities, Dr. Evan Osar. He is the developer of the Integrative Movement System, and he's based in Chicago. And I coerced him into coming on live today to talk a little bit about the importance of breathing and how it impacts so many functions of our day-to-day life. I don't think we always realize how important breathing is, particularly breathing, as Dr. Osar refers to it, as three-dimensional breathing. And I suspect he's going to tell us a little bit more about that today, right?
Yes.
So without taking up any more intro time, I'm going to turn everything over to you, Dr. O. I'm going to put myself on mute. For those of you joining us today, if you have questions at any time, there's a little Q&A box down below. Please feel free to post your questions in there at any time. If it's relevant to what Dr. Osar is speaking about at the moment, I'll interrupt him. But otherwise, we might just wait until the end to do all of that Q&A. Is that okay with you?
Perfect. Sounds great. Please ask questions because we're here to serve you. We're here to help you understand this information and, more importantly, not only understand it, but apply it to your everyday life as well.
Yep. And before, I'm just going to say one more thing. For those of you that are clients of Evolution Fitness and Wellness that are watching this right now, this shouldn't be totally new information to you guys, because we do implement a lot of this information in our day-to-day training sessions. But if you don't have a really great understanding about the importance of breathing, chronic tightness, how it plays into balance and posture, I hope that today's webinar will help you with that. So without any further ado, Dr. O, take it over. I'm muting.
Thank you. Appreciate it. Thank you so much for joining us today, and thank you for allowing me to share this information with you. The biggest thing I want you to get out of this presentation is perspective, and to be able to actually use this information in your everyday life, because we truly believe, so this is my team, my wife Janice is right next to me in that image, and then our full-time integrative movement specialist, Sarah Fisher, who's been with us in our business for the last 15 years to 16 years, and Jill, who's a longtime friend. She was actually a student of mine in massage therapy school. I taught her literally 20 years ago, and now she works with us for the last few months. Obviously, we're on lockdown, so we're not together anymore, but that was right before we were on lockdown. So I am a chiropractic physician by trade. I went back to massage therapy school once I started teaching there because I realized I didn't have a lot of great soft tissue skills. I got certified through almost every organization that's been out there. So I've been in this industry for over 22 years. I was in 10 years in college before that, working as a personal trainer. I've written several books on corrective exercise, posture, and movement. So you can say I'm a speaker. I speak all over the world on this topic. So I am a specialist in this arena. However, it really wasn't always that way. So when I started, like I said, I came to Chicago. That was my first job out of Palmer College of Chiropractic. And I wasn't making much money as a chiropractor. And I went back to personal training because I had free time in the morning. So I went back to the East Bank Club of Chicago. So at the time, it was the #1 money-making club in the country. And if you look at the East Bank Club, the picture's down there. It's right on the east bank of the Chicago River. Chicago River is dirty and nasty, but they're starting to clean it up a little bit. But the club itself is a city block long. It's 4 stories high. It's basically like a country club in a block radius, so to speak. That's its cardio room down there. It has 300 pieces of cardio. It's the most fantastic club I've ever been in my life, and I've been in a lot of clubs around the country and around the world. There's no club like this. So at the time, I'm a young stud, or I thought I was, and I wanted to work with primarily athletes. Michael Jordan worked out at the East Bank, so I wanted to work out with him. Members of the Blackhawks and Bulls worked out there, and professional athletes. Some of the Bears players worked out there. Oprah Winfrey worked out there as well. Maybe she still does. I got to hold the door open for her one day, and she just walked through. And I'm like, hey, and she just ignored me. So that's my claim to fame of working at East Bank Club. Now, like I said, these are the people I wanted to work with. I wanted to work with all the stars and the celebrities and the who's who. Well, they knew I was a chiropractic physician, so they did not send me those clients. They sent me these clients. And what I quickly realized, I've been in college for 10 years. I'd worked several years as a personal trainer. I wasn't prepared to work with these individuals. Even with all my knowledge, all the schooling and education I had, I wasn't prepared to work with these clients that had knee pain or back pain or spinal stenosis, problems with balance and walking. And I got I'm a guy like very much like Jackie and Jason are. I'm all about learning. I want to be the best at what I do. I mean, so I got to the books. I went to seminars, tons of seminars. So my education cost me $150,000, and this is going back 22 years. So now you're talking about probably $250,000 to $300,000 in today's dollars. I spent another easily $20,000 to $50,000, somewhere in that range, trying to continue to learn and grow my education because I was so frustrated because I wasn't able to help my clients. Now, most of these seminars I went to, they were telling me to train people like athletes because most of these people work with athletes, and they're like, oh, okay, older people are like athletes as well. So you need to train them like athletes, and you need to train them dynamically. And you still hear a lot of that today in our industry. And Jackie's probably familiar with some of that education as well. Well, my clients really didn't get better. And in fact, some of my clients got worse. But I still wasn't convinced. I still was convinced by these other gurus that you need to train people like athletes. And it really wasn't until I started to discover and actually get injuries. I started to get serious shoulder injuries to the point where at one point I could lift a lot of weight over my head. I was real strong. I was at the peak of my fitness and athletic career back then. I went from being able to press 180-pound dumbbells, 90-pound dumbbells in each hand overhead to the point where I could barely lift 10-pound dumbbells over my head. I got completely frustrated, and I was really angry at the time because it really was risking my career as a chiropractor because I was injured. I couldn't do the manual work. I couldn't work out. Working out is a big part of my life, my entire life, I should say, not just recently, but my entire life. I was physically active, and not being able to lift and do the things I needed to do was really frustrating to me, and not having answers. And that's really what led me on this journey to discover the integrative movement system and develop it to work with myself selfishly just to help my own shoulder problems so I could continue to do my job as a chiropractic physician. But what we found also that this information started to help our clients and patients that came into our office here in Chicago, integrative movement specialists. And what's really cool about it is one of the #1 rehab facility in the country is here in Chicago. And I would get clients from the Rehab Institute of Chicago, not referred, that's self-referred, because what they would say is their therapists at the Rehab Institute of Chicago at the time were referring people to my videos online, my YouTube videos, and they're saying, hey, you got to watch this guy. He actually does these exercises properly, explains it properly. And they're like, why should I come to you if you're showing me his videos? They started to come to me. And that was really when I knew that, like, okay, we got something here, and it's just something we can start to teach to fitness professionals. And that's what we've been doing for the last 15 years, is really just educating health and fitness professionals, because we do believe they are the solution to the healthcare crisis. So what I want to share with you really today and the rest of our time together is that you can't train if you look like this, and if you're in this age group 50 to 70, you can't train like you're in your 20s and 30s. I can't train like I did in my 20s and 30s. I'm 51. I just turned 51 a couple of weeks ago. I can't train like I used to do. I want to train mentally. I'm like, I'm ready to train hard, but physically with rotator cuff tears, labral tears in both shoulders, I can't train that way anymore. And this is not to mean, and please don't get me wrong, I do not mean you can't train hard or stress your body and or progress yourself to a high level, to your best and most optimal level. That's not what I mean. But you can't just go to these crazy exercise classes or watch these programs online, not work with a qualified professional like Jackie and her husband Jason, and hope that these sort of approaches are appropriate for you if you have chronic injuries like tightness or low back discomfort, knee problems, balance problems. You need a specialist. You need to follow and listen to people who have been trained in working with the older population and understand how to work with this condition. Because especially now that we're all in lockdown, if you look around social media, if you've been following that at all, Jackie, I know you've seen this, I've seen this, you see everybody and their brother now becoming fitness specialists. It was always like that, but now it's even worse. You've got everybody doing exercise and fitness and home exercise routines because that's the only way people are making money today. You know, one of the few ways people can make money is just doing online training. But again, so there's a lot of people out there giving information that isn't great information. So that's why I love sharing with Jackie and her husband and her community, and why we educate health and fitness professionals so much. So what we're going to share with you today is corrective exercise, which is a very specialized way to exercise for posture, for balance, and pain reduction. And what's great about this approach, and the approach that you've probably learned from Jackie if you've been working with her and her husband and her team, and if you're new to this information, if you're watching us on social media somewhere, this information is valuable not only to improve your posture, but it can improve your balance as well as reduce pain. And that's why this system is so effective at changing people's lives. And yes, I do mean that. People change their lives. I changed my life being able to continue to do my job without any surgery. I take 0 medications. I've taken 0 medications in 26 years. It was the last time when I was in college that I took medication. My wife had chronic migraines. She uses the exact same approach. She had migraines from the time she was 5 to the time she was 25, was on birth control pills for migraine control. She was on ibuprofen literally every single day for migraine control. She was drinking Coca-Cola every day for migraine control. Since we started using this information, and she was really one of the first people I took through the system, she's had 0 migraines, 0 migraines. She's taken 0 medications in the last almost 15 years since she stopped having migraines once we got her doing the things that I'm going to share with you here. So you can change people's lives. You can change your own life if you apply this information, because the information is only as good as it is that you apply it to your life. Now, I love this picture right here, and I share it with everyone that will pay attention to me in all our courses. It's in my book, or I should say it's going to be in my new book, because I didn't find this until after I printed my last couple of books. But this is what we all once looked like. We all had some level of optimal posture and control. And if you notice this baby, this beautiful picture, and this is one of my favorite pictures besides the picture of my niece. This is not my niece, but I love what it illustrates, because you see the perfect alignment of her head and neck over top her rib cage, over top her pelvis. And she's looking down at her toy cell phone, which will very quickly be, within months, probably a real cell phone. And that's the reality of our life today. So it really illustrates that we once were born the way we were supposed to. We functioned the way we were supposed to before life got to us. Now, I want to share with you a picture of my client. What's different about this posture than the posture of a child? Many things are different. The head is very far forward. The neck is very tight. The shoulders are forward. The shoulders are tight. The abdomen is distended, and the low back is tight. The hips are tight. Knee discomfort. Many things have changed because our posture and our movement strategy has changed so much over the course of our lives that it's not our genetics. So this is another thing I want you to really get. So hopefully you're taking notes, please write this down. It's not your genetics. It's not what your mother was like or your father was like. Please don't listen to what medical doctors tell you about your genetics, because it wasn't. We're all born with a specific genetic code. Yes, you may have been born with more of a predisposition to having high cholesterol, for example. Maybe you were born with a predisposition to having looser joints, or maybe tighter joints, or maybe you have shallow or deeper hip sockets than someone else. We're all born with a genetic hand. We can't change that. But what we can change, what I'm going to encourage you and stress, and what Jackie and Jason are trying to educate you on, or have been educating you on, is there's things within your control. Your posture and your movement habits, your exercise habits, your eating habits are within your control. And that's ultimately what dictates how your genetics are expressed. So I really want you to understand it's all about habits, and you have control over your habits. You don't have control over your genetics, but you do have control over your habits. So listen to your doctor about your medications and so forth, but then also listen to your fitness professional, your health and fitness professional, when it comes to posture, movement, and the things they're asking you to do, and do them on a regular basis. Just like you do anything that you want to get better, you do it every single day. The things we're going to share with you, you want to do every single day. So life happened to us. We became very sedentary. If you look at children, and they're just dynamic. They're always, like I was FaceTiming with my little niece yesterday, 10 years old. And she was like, I'm laying on the couch exhausted. She's bouncing all over the place. She's running around. She's jumping up. She's doing flips. We have dance offs. I dance off with her for about 30 seconds to a minute. I'm exhausted. She's still going. She could go all day long. So it's a lot of fun, but I get quite exhausted because we've lived such sedentary lifestyles. We've had stress and trauma and emotional things that have happened to us. Maybe physical stress or trauma, or emotional things or physical trauma to our bodies. We've had arthritic changes to our joints related to injuries, surgeries, and trauma. Maybe you've had multiple children that have changed your body. Maybe you've had C-sections and hysterectomies and other surgeries that impact your body, because all surgeries impact your body regardless of what your medical doctor tells you. My wife is a specialist in working with women after they've had surgery, like C-sections and hysterectomies and low back surgery. I mean, that's a lot of the people we see here in our clinic, because it changes how your body reacts. This is what we talk about. Life happens to us. We can't control a lot of the things that happen to us in our lives. We can control the things that happen, or the reactions that we have, the education we take in, and as well as the actions we use based upon the information that we have. And again, this is why I love sharing with Jackie and her community. So this is why I put this slide up here. Responsibility is the price of freedom. And unfortunately in this country, we've sort of taken freedom for granted. And we forget that we have a responsibility when you have freedom. You have a responsibility to take control of your healthcare and not rely on your doctors. Yes, your doctors are guides. When people come and see me, I'm like, I'm your guide. I'm your educator. It's your responsibility to go home and do the work. If a doctor gives you medication for diabetes, for example, or heart disease, it's your responsibility to go home and take that medication, to change your eating habits, to get more active, to work on the things that you have within your control. That's the responsibility we all bear for the freedom that we have here in the United States. And sometimes we need things like this, like what's happening today, to remind us that, wow, when freedom is taken away from us, life is much different. So I want you to think about that with your health as well. When somebody takes away your freedom to be healthy, or when you don't take responsibility for your health, a lot of things are not going to be great that happen with your health. So please, my biggest message to you when you leave this webinar is take responsibility for your health. Get the education, use the education, and be responsible for your health. And we'll help share with you some tips that will help you do that. So what's the number one thing you can do for your health? Number one thing that you can do for your health, besides healthy diet, and I think this is actually more important than a healthy diet, is the number one thing you can do for your health is breathing. And it's the way you breathe, because a lot of people will come into us, and Jackie, I'm sure you have the same conversation with your clients, but I'm already breathing. I'm like, yeah, that's great. Yes, we're all breathing. That's great because you're alive. So that's the first thing, is you're breathing. But I want to ask you this. How's your balance? How's your walking? How's climbing stairs? You've been standing and walking and balancing and doing stairs your entire life. Has that gotten better just because you've been doing it? No. Breathing is the exact same way. Breathing doesn't get better or more optimal or more efficient just because you've been doing it your whole life. Because the one thing that I want you to think about your nervous system, remember your nervous system is designed to keep you alive. It's not designed to optimize you. It's designed to keep you alive, because remember back in the day, before we had all the modern conveniences, we were being chased by other people, or maybe by animals. We had a lot of things in everyday life, back tens of thousands of years ago, that we were dealing with environmental things that we were dealing with, trying to stay alive through winter, when we didn't have heated houses and central air and all that good stuff. So our nervous system is optimized to keep us alive. It's not optimized to make things optimal or efficient. Breathing has become very non-optimal and very inefficient because of all the things we talked about, because of stress, because of sedentary lifestyle, because of not challenging our bodies the way we were meant to, by not breathing right as a habit. And that's why things like meditation work so well. Yoga, Tai Chi have been shown to be so effective. And that's why our system that I'll share with you here is so effective as well, because we restore optimal breathing. And here's why optimal breathing is so important. Because number one, it helps keep you alive, and it helps to regulate the gases in your body. Many of us are breathing way too fast, too shallow and too fast. So what happens is we start to give off too much carbon dioxide. We don't retain enough oxygen, I should say. We don't retain enough carbon dioxide. So what that actually does is it causes vasoconstriction. It causes your blood vessels to shrink. That raises your blood pressure up. That decreases the amount of oxygen you can take up by your brain or the cells of your body. That increases how fast you must breathe. So the one thing that happens is we want to slow down how fast we're breathing. So one of the things we're going to share with you is, how do you slow down how fast you're breathing? You have to train that, because we've all gotten to the point, or many of us have gotten to the point, where we're breathing way too fast. But this is another reason why breathing is so important. It's postural control. There's lots of research coming out now that it's not just muscles that hold us upright. It's not just gripping and tightening muscles that hold us upright. What actually happens is muscles, when they become too active, they actually lock us down. And when you saw my client earlier today, when you see a lot of our postures, and we see this sort of slumped down posture, it's because your muscles have been working way too hard. They're trying to pull you down to stabilize you and not allowing you to be long and tall and create space in your joints like we should all have, like we did once as children. But it also then will create the proper mobility, or the movement of our joints and our tissues, all the organs inside our rib cage and inside our pelvis and abdominal region. Breathing helps you mobilize all that tissue and keeps you loose. So when clients come in here to my office and they say to me, "Doc, I'm just so tight. Do I need to do yoga? Do I need to do Tai Chi? Do I need to do more stretching?" I'm like, "Yeah, that's all good. But it doesn't matter if you don't breathe right, because breathing is what gives you mobility and helps you keep flexibility and range of motion." When clients tell me and tell you, "Jackie, what I'm tight," what they're really telling you is, "I'm not breathing well." People that breathe well don't get tight. It just doesn't happen. And it doesn't matter how inactive you are. If you're breathing three-dimensionally, you will have mobile joints. You will have a mobile, tissues within around your rib cage and your shoulders and your low back. You will not get tight. Yes, you have to move as well and get out of your chair quite a bit. But when you're breathing three-dimensionally, as we'll discuss and demonstrate here, you will not be tight. It's remarkable how much this changes. We hear this all the time for our clients and patients. And that's why this is the number one thing you can do outside of your mindset, getting your mindset right. This is the number one thing you can do for your health, bar none. Even more important than diet, because you can't go very long if you don't breathe. You can go a long time not eating food. You can't go very long without water, but you can go a long time without eating food. But you can't go very long without breathing. And you just won't have a great quality of life if you don't breathe well. Okay, so there's a study that came out in 2018, and it looked at the impact of the diaphragm basically on balance. And what they found was, the better you breathe, the better the balance. So they took a group of individuals that had surgery to their rib cage or their lungs, and a group of people that didn't have surgery to their rib cage or lungs. And the people that breathed better, the people that didn't have surgery, they had better balance. When they had surgery, so they had a lot of compensation, so a lot of muscle tightness, maybe scar tissue, maybe muscle weakness related to that surgery, their balance wasn't as good. And if you look at any of your friends or family or colleagues that balance well, not the ones that don't balance well, but the ones that balance well, what they all have in common is they're breathing well, because you can't balance well without proper breathing. You will not walk, if you can't balance well, you will not walk well as either. So you won't balance well, you won't walk well, and then you'll be more sedentary because you'll have a fear of falling. And that's what we see with so many of our clients that come to us. And again, just reinforcing why breathing is so important. The better you breathe, the better you stand, the better you hold your posture, the more mobile you are, the better you react, the more reactive you are, The more balanced you are, the more you'll be able to experience life. Because what they've also shown in studies is what happens to the diaphragm, your main breathing muscle that's within your rib cage, when we age. What happens is, and you see, again, another picture of my client, that forward head, the forward shoulders, the big distended abdomen because he's not breathing very well, and chronic low back and neck tension. What happens is atrophy just means, it's a fancy word that means muscles weaken and get smaller. So when people don't breathe well, as we get older, you get atrophy or weakening, and the muscle shrinks, and decreased trunk, spine, and organ, or all those tissues inside your rib cage and pelvis and abdomen. You have decreased mobility, so you have decreased flexibility, as we just talked about. But they've also shown there's a 30% decrease in strength of the diaphragm. Not only all the muscles in your body, but your diaphragm, your main breathing muscle, becomes 30% less efficient. Can you imagine? Just think about this now. Think about being 30% less efficient than it should be. Can you start to get a feeling of how that can impact your health when your muscles, your main muscle of breathing is working 30% less effort or less effective? Think about your car. What if your car was operating 30% less effective? You'd be using 3 times as much gas. Or I don't know, I just sort of made it up. You'd be using way more gas, and you'd be putting way more wear and tear on your car if it was 30% less efficient. So again, think about that with your body and your breathing as well. And the stiffer you are, the less you're breathing, the more compromised your posture, the more it will lead to increased stiffness and fall risk. And again, that's what all the studies are starting to show. Balance is not just about standing there on one leg and hoping you can balance and working on that. That's a part of it. But you have to breathe right to get your posture right. You have to have posture right to get your breathing right and to maintain your balance. So that's what I'm continuing just to stress to you, the importance of posture, breathing, balance. They all fit into and relate to each other. So how does this impact posture? Well, we get sarcopenia, which is a fancy word that just means you start losing muscle strength and mobility issues. You start getting balance issues, as we've talked about, but you also get cognitive decline. There's such a big emphasis today in the health and fitness world about cognitive health and making sure your brain stays healthy. Well, the number one thing you can do for your brain, besides nutrition, is breathing. Because when you have that vasoconstriction, the narrowing of the blood vessels, because you're not breathing right, because you're breathing off too much carbon dioxide, you don't get as much blood to your brain. You don't get as much oxygen to your brain. You will get cognitive decline. You will be brighter, more energetic, and more alert when you optimize your breathing. And we're going to show you how to do that. So this is a client of mine because we think belly breathing, or we've been told, and I used to teach this, belly breathing is what you're supposed to do. But now I've learned belly breathing is not what you're supposed to be doing. And this is a perfect example of it. This is my client I showed you in this last picture. Let me just go back here. Let me just show you. This is this guy here breathing when he's lying down. He's a belly breather. You see this big distended abdomen right here. He breathes in and then he breathes out, but there's no rib cage motion. 3-dimensional breathing, as we'll discuss here in a little bit, I'll show you how to do it, is all about creating expansion of your entire rib cage. So it's top to bottom, side to side, as well as front to back. It's not just belly breathing, because most of us, not all of us, most of us have defaulted to doing belly breathing. And that's why most of us have distended abdomens, because the only way we can breathe when we get stiff and rigid and tight, because the muscles are tightening down, is to breathe through our belly. So belly breathing is not proper breathing, no matter what you're learning in yoga or Tai Chi, but you're learning from Jackie, so you're learning from a good resource. So if you look at our children again, this perfect alignment I showed you earlier, this is my little niece at 6 months of age. She's now 10, but at 6 months of age, you see this perfect alignment of her posture, whether you're lying down or this little child here sitting up. And these Middle Eastern women demonstrate what it's like when you have proper posture, balance, and muscle coordination. When you're breathing well, you're able to support massive loads on top of your head, because this is the most efficient way to carry heavy loads for long periods of time. For miles upon miles, these women carry these heavy loads. I have a picture of women stacking bricks on top of their head and carrying bricks that way. That's the most efficient way. It's actually not holding it down here. It's holding it on top of your head, because you don't have to use a lot of energy to do that. You just need the proper alignment, and you need the proper breathing to make that happen successfully. And that's what core stability is all about. It comes from aligning your joints in the right position, and it comes from breathing right. So this is my little niece here at 6 months. These principles, alignment, breathing, and control, what we refer to as the ABCs, alignment, breathing, control. These are the principles of the integrative movement system. And if you look at my niece, when she's lying on her back in the happy baby position, because she looks pretty happy, right? Here she is in a plank position. You see a beautiful little plank here. And here you see herself learning how to pull herself upright. You see the beautiful alignment of her rib cage, her spine, and her pelvis. You see the beautiful alignment of her hip, knee, ankle, and foot. You see the beautiful alignment in the plank position. I love this picture. And I'm going to remind her for the rest of her life that once upon a time, so if she becomes a bratty little teen, I'm going to be like, hey, remember, you used to like your Uncle Evan. You used to hang out with us. We used to have fun. But again, just to illustrate the importance of these three principles, the ABCs, alignment, breathing, and control. And this is why Jackie and Jason stress this so much to you during your exercise programs, because this is what we did early on, that we all did, that helped us create optimal and efficient posture and movement. So I'm going to share with you a story and case study about my client and my friend. She's become a dear friend of mine, Debbie. Debbie is 70 years of age. She came to me over a dozen years ago. She had chronic hip problems, hip tightness. Ultimately, she needed bilateral hip replacements, but she also had a fused big toe. She has cervical and lumbar spinal stenosis, and you guys may be familiar with that term. It's a narrowing of the spinal canals because of osteoarthritic changes to her spine. She's got cervical or neck-driven balance issues, so she'll lose her balance when she turns her head. She's got pulmonary lung disease. She's got aortic valve stenosis. So she's like a lot of the clients that come and see us. And Jackie, I'm sure that you're familiar with a lot of these conditions because your clients are coming to you with these similar conditions. Again, many of us have these conditions. We can't address specifically some of these right now, but we're going to, again, take responsibility for the things that are within our control, regardless of your medical history. Yes, we want to be cognizant of the medical history, but also remember that we have responsibility to address the things that we can take responsibility for: our posture, our breathing, our movement, our mindset, and our nutrition. Those are the things that are within your control. So this is what happens when you don't breathe well. And this is very common. We just don't see it because we're not testing for it. Medical doctors don't test for these things. This is what we test for in our clinic. This is what we teach health and fitness professionals to look for: the signs when you're not breathing well and when you're not using your core muscles well. So this is Debbie. She's predominantly a belly breather like my other client was. This is what happens when she lifts her leg and tries to use her core muscles. Watch her abdomen here. See that big distension right there. Your abdomen should not distend. You see, she's like, what are you looking at? My distension of my abdomen? I'm like, yes, I am. Her belly's pushing out. That is not how you should stabilize your core when you're doing core exercises. We should not be bearing down, but when you're belly breathers, you cause more pressure to go down towards your belly. That causes more stretching of your abdominal wall. You're not able to use your abdominal wall well. Your back will get tighter. Your hips will get tighter. And again, this is what directly led to one of the things that directly led to Debbie having bilateral hip replacements. So hip replacements are also related to our breathing because you start using muscles too much, not effectively, not efficiently, and now they start becoming tight and restricted, and the joints just start grinding down over time. And this is why this information can help you regardless of where you are. If you've had joint replacements, if you're going for a joint replacement, or you're coming out of a joint replacement, you can still improve your breathing, still improve your posture and movement.
So Evan, I'm going to stop for just 1 second and ask you, you addressed diastasis there. How does belly breathing, or because I don't think you and I have ever talked about this, how does belly breathing, or does it or does it not impact also folks that have a diagnosis of like a hiatal hernia?
Great question. Breathing and hiatal hernias are directly related. Absolutely. Your medical doctor, again, and it's not to pick on medical doctors, they're just not trained this way. This is what we train for as chiropractic physicians, as physical therapists, as health and fitness professionals that work with posture and movement. Because the diaphragm sits in your rib cage. I'm going to stand up here just for a moment, right about here. So it wraps all the way around your rib cage, all the way to the back. And it's like a piston inside your rib cage. And it goes like this, okay? Now, your esophagus, so your esophagus comes from your throat down behind your chest bone to attach it to your stomach. So it attaches sort of right about somewhere around here, the left side of your body. Your stomach's sort of right here underneath your rib. Well, the esophagus goes right through your diaphragm, okay? So, and it's And what happens is the esophagus, should say the diaphragm, when it contracts, it actually helps to close off the esophagus. So there's a sphincter down there, the esophageal sphincter, and the esophagus is what moves the food down into your stomach. The diaphragm helps to contract and close off your esophagus so that when you're breathing and when you're moving, you're not sending gastric stomach acid back up into the esophagus, because that's ultimately what causes a hiatal hernia, because a hiatal hernia is basically when the stomach starts moving back up into that space where the esophagus is, because the diaphragm is not functioning properly. The client is not breathing properly, and the diaphragm is not in the right position. And the biggest thing we see with almost every client that comes in here with a hiatal hernia or regurgitation, gastroesophageal reflux disease, or heartburn is their rib cage is exactly what we saw in my client. It's flared out, their abdomen is distended. We see that in clients that have asthma as well, because they also have this big rib cage position, or this very flared rib cage position, and overstretched abdominal wall because they're gasping or struggling to get air mostly out, but because they can't breathe and get the ribs to come back down. So when we start to see these things like hiatal hernias, we say, oh, it's just the acid in your stomach. No, it's not the acid in your stomach. It's the non-optimal position of your diaphragm. It's not closing off the esophageal sphincter. It's not positioning your rib cage in the right position. And you can go tell your doctor that, because there's tons of research, not just one or two. It's not just my opinion. There's tons of research on gastroesophageal reflux disease and changing that, getting rid of acid reflux with putting the diaphragm in the right position and using it appropriately. It will stop a lot of these issues that people are taking all this antacids. And antacids, I'm going to just be on my soapbox for 30 seconds here. Antacids, if you're on antacid medication, I'm not saying get off of it. Do not get off of it. That's not what I'm saying. I'm saying you go have a conversation with your doctor, because what's going to happen is the biggest thing that the acid does for your body is it helps you digest calcium, not digest, but basically absorb calcium. You will start to get bone demineralization. So you'll start to get osteoporotic because you're on these antacids. You will not kill off viruses. And we have a serious issue right now with the virus, as we all know. You will not kill off all the bacteria and viruses you take into your body because your acid level is too low because you're on antacid medication. So I really want you to take this to heart and not get off your medication. I'm not telling you, I'm not your doctor. I can't tell you to get off medication. I want you to start having education with your own healthcare practitioner about this. But first, start learning how to breathe right and see how that impacts your reflux.
Thank you.
You got it. Great question. Okay, now, how do you breathe well? Or how do you train yourself to breathe well? I apologize. I did not bring a strap in here, but let me go grab a strap, and then we'll come back and we'll discuss how we do breathing. Let me just show you this video real quick. This is my client, Debbie. This is how we teach her to do breathing. So we use a yoga strap, and we wrap it around the rib cage, not around the belly, around the rib cage. We have her breathe into the strap. You won't see a lot happening in this video because she's breathing. But she's using the strap to breathe into her rib cage side to side, as well as front to back. Remember, our clients are breathing too much into their belly, just like we saw in those pictures earlier, as Debbie was. Now we're teaching her how to breathe more into her rib cage, front to back, side to side, that three-dimensional breathing, using the entire diaphragm in the breathing process. So watch this video. It's almost over. Let me go grab a strap. I'll be right back.
So while Dr. Osar is stepping away to grab that strap, I will tell you that this breathing strategy is exactly the same thing that I practice myself, which helps me with tightness that I have in my shoulder, directly related to a labral tear that I also have in my shoulder. So what I can tell you, as I teach this in my own personal training studio, my husband and I both practice this strategy. I've learned it from Dr. O. I implement it every single day in my daily life, and it has had a huge impact on my own posture and my ability to manage the issue that I have in my shoulder as well.
Awesome, awesome. Now, the other thing I want you to, I'm using a resistance tubing because that's what I have right here. I don't have my yoga strap handy right now. But what you can use is anything that will go around your rib cage. So you can use a bathrobe, a bathrobe robe tie, use that. That works really well. If you do have a yoga strap, use that. If you have an elastic tubing, use that. And basically what you're going to do is you're going to wrap it around your rib cage above your chest. So I'm going to wrap it around my rib cage here, just like this. And I'm going to grab it in the front here and just keep it snug. If it's long enough, you could cross it over like this, but this one's not long enough, so I'll just kind of hold it like this, okay? Now, here's the next most important thing. You're going to breathe through your nose. The other problem with breathing that most of our clients have is they're mouth breathers. Their head comes forward, their jaw goes open, and they become mouth breathers. And that's another reason I believe so many people have sleep apnea, because you become a mouth breather, you do not tone your inner muscles of your mouth and your throat. The throat drops down when you breathe, and now it clogs your airway, and then you get sleep apnea. Again, don't get off your sleep apnea machines if you're on them, but breathing can help sleep apnea, I believe, as well. So here's what I want you to do. The other reason why breathing through your nose is so important is because when you breathe through your nose, it warms, it moistens, and it filters the air. When you breathe through your mouth, it doesn't warm, it doesn't filter, and it doesn't moisten the air. So you're breathing very dry and particle-filled air. So don't breathe through your mouth. The last reason why nose breathing is so important is we talked about carbon dioxide. Carbon dioxide is important to create vasodilation, or opening of blood vessels. The more you breathe through your nose, the more you activate the ability to get carbon dioxide. I should say it's actually carbon. Hold on, let me think. Hold on. Produce nitric oxide, which allows you to vasodilate. So you retain more carbon dioxide, you produce more nitric oxide, which allows you to vasodilate, or open up your blood vessels, and that's ultimately what helps circulation and get more oxygen to your tissues. That's another reason why you want to nose breathe. You do not get that same reaction through mouth breathing. And there's a study right now that actually showed, I have to go read it, so somebody just sent it to me, that the more you nasal breathe, the more you actually produce nitric oxide, and it kills viruses, which is another reason why you want to nasal breathe. The more you mouth breathe, the less likely you are to kill any virus. Okay, so here we go. So you get your strap wrapped around, and if you have a strap, I want you to grab it right now. If you don't, just do this with me regardless.
Grab mine too. Hang on one second.
Cool.
All right.
Yep. So I want you to think about being long in your spine. What long in your spine means not bringing the chin up like this. It's being long through the back, as if somebody's pulling you from that back knob in the back of your head, pulling you this way. So that way you're getting pulled up, not this way like this, but this way. So just get a little bit longer, because if you looked at those pictures of my little niece and that girl's sitting, you saw that nice length in their spine. Length comes from the back of your head, getting pulled up towards the ceiling. Remember, you're going to keep your mouth closed. You're going to breathe through your nose. We'll wait for Jackie to come on back. But again, grab your strap if you have it. You just want to snug it up, not super tight like you're constricting yourself, but just snug it up so that you can feel yourself expanding into your rib cage. The last thing you see on your slide, you see control. Use the entire TPC. Don't worry about that. That just means use your entire rib cage, spine, and pelvis and abdomen in the breathing process. Okay? So here we go. All set? So long spine, like you're being pulled up from the backside of your head and neck. Okay? You're going to close your mouth now. You're going to breathe in through your nose. So you breathe in for a count of 3 to 4 seconds. So breathe in, pause, and then breathe out for a count of 6 to 8 seconds. And pause. Breathe in through your nose again for 3 to 4 seconds. Pause. And breathe out for a count of 6 to 8 seconds. Pause. And then one more breath like that. Breathe in. Pause. And then breathe out for a count of 6 to 8 seconds. So 8, 7, 6, 5, 4, 3, 2, 1, and relax, go back to your normal breathing. So that's how we breathe. We want to breathe it out twice as long as we breathe in, because we want the ribs to come down. We want the abdominal wall to come closer together to work almost like our internal corset, because that's what the deeper abdominal wall does. And we only get that when we breathe out twice as long as we breathe in. The other benefit of breathing that way is it allows you to relax your body and get into more of what we refer to as the parasympathetic nervous system, or the relax, the rest and digest part of your nervous system, versus like that real anxious and stressful part of our nervous system. Because again, we're in a very challenging time and a lot of people are dealing with a lot of stress. So the more you breathe this way, so breathe it out twice as long as you breathe in, take a pause at the end of inhalation, your breath in, and take a pause at the end of exhalation, your breath out. You'll elongate your breathing cycle. You'll slow your breathing down. You'll get more oxygen into your system because you retain more carbon dioxide. You produce more nitric oxide. And you ultimately will feel more relaxed and improve how you're breathing. Now, we also want to take this into exercise, however. So we want to make sure that we're also able to exercise this way. So I'm going to show you what we do with Debbie. So this is Debbie doing what we refer to, the two most important exercises we give our clients is number 1, breathing. Number 2, hinging. Hinging is what you'll see Debbie do here in a moment. Hinging is how you use your hips properly. You hinge your whole body forward and then stand up. So she'll hinge first and then she'll stand up. So kind of watch what she does.
Hang on
so
one second, Dr. O, before you start that, give me 1 second.
Yep.
So Donna, I see that you had your hand up there. So if you'll go to the chat box, I'm kind of monitoring that chat box. If you can find it, it should be towards the bottom of your screen.
Can you actually read that? Because I can't see it unless I click off this presentation.
Yeah, no, it's okay. She raised her hand, but I don't see a question. So Donna, if you can hear me, go ahead and go to that chat box and type your question in. And then when I see it come across, I will ask Dr. O.
Okay, perfect. Okay. Thank you.
Yep.
And feel free to ask questions, and we can come back to this at the end as well, for sure. Okay, so now what I'm having Debbie do is hinge her whole body, not just her hips, not just her low back, but her whole body. This is how we're going to have her breathe as she's hinging. So I'm going to just move the screen a little tiny bit here so you can see me hinging. So what we're going to have Debbie do is she's in a nice long spine position, and what she's going to do is she's going to hinge forward and then hinge back from her hips, not her waist, from her hip joints. So she's going to hinge forward, just continue to breathe, and then you'll start to see her stand up. So let me just cue this up, and then we'll talk about her breathing as she's doing this.
Okay, Dr. O, so here was Donna's question, because you may address it in this as well.
Yep.
Donna wants to know, when she's practicing her breathing, should her abdominal area actually be moving as well?
Yes, absolutely. Great question, Donna. Thank you for that, because I did not mention that. When you breathe, your abdominal regions should move. So again, I'm gonna stand up so you can see me here. Let me see if I can put this, because I'm wearing black and it's kind of dark in this side of the room. Let me turn this around here so I can get to a lighter portion of the room.
We can actually see you pretty good, Dr. O.
Oh, okay, cool. So I'll stay here then. Okay, so I'm gonna just belly breathe. So here's belly breathing. That's just belly breathing. Now I'm gonna go more into my 3-dimensional breathing. So I'm gonna grab my strap here. And now I'm gonna breathe into my strap. Watch my belly. It still moves, just not as much as belly breathing. So one more time, I'll breathe in. And then breathe out. It's still moving, just not as much as when you're just belly breathing. Your belly should still move, but not that excessive belly breathing. So that was a really great question. Thank you for asking that.
And then Lisa, who jumped on, if you could just repeat again, Lisa. So Lisa's question is, sorry, I stepped away to get a strap. Breathing, inhale through nose, exhale from mouth or nose. And Lisa, the answer there is we want you to try and inhale and exhale both through the nose and not the mouth.
Yep.
Now, because this is, for some of you, this might be new, and I get this question a lot when I'm teaching this in my studio. In the beginning, taking these deep breaths in and then the pauses and exhaling for anywhere from 6 to 8 seconds, like that that is going to be a practice thing. Initially, in the beginning, you may not be able to do that exhale for that period of time. But our goal is to get to that 6 to 8 second exhale as well, okay? So don't get frustrated when you start this.
Yeah, correct.
If it's short, like you feel yourself almost having to do that next inhale, like gulp, right, a second time, and then exhale out.
So one way to start to work on that, and again, thank you for bringing that up, Jackie, because I did not mention that. One of the best ways to work on your breathing, like elongating your breath, because that's really the key to improving your breathing, is to elongate your breath, is use an app. The app I use is called the letter I, Breathe. So there's lots of apps that do this, but in the app, I Breathe, what you can do is you can set the amount of seconds you want your inspiration, the amount of seconds you set the pause, the amount of seconds you set the expiration, and the amount of seconds you set the pause after you blow all the air out, okay? So use an app, because that way you can start to train yourself, and then as you get better, as Jackie mentioned, you just start to increase the length of time. I've gotten to the point where I've got it set at a 6-second inhalation, a 3-second pause, a 12-second exhalation, and a 3-second pause. So I'm basically taking 2 breaths per minute, because the less breaths per minute you take, the more efficient you will become. But it's like anything. It's like doing squats. In the beginning, you could only do maybe 5 squats, and then you work at it, and then you're doing 25 squats before you know it. Same thing here. In the beginning, you're just doing, you feel like you're going to choke or run out of air. You're not going to run out of air. Your body has plenty of air reserve, but it does feel that way. So just build up to it slowly. And again, as Jackie said, breathe in through the nose. You can blow out through lightly pursed lips. Don't blow out like you're trying to blow out a birthday candle. Just blow out like through lightly pursed lips, and you'll build up to it very quickly. It's like it's like training any movement or any muscle in your body. You just have to retrain that diaphragm and all those breathing muscles to work together and just become more efficient. Good? Awesome. Okay. Now, let's add our hinge to this. So what I want you to do, if you're watching this in front of your computer, which obviously you are, I want you to stand up and check your balance. So let me step away from the computer just a little bit. I want you to check your balance, because we're going to do this together, and I want to show you the impact it can have on your balance. So stand up, and what I want you to do is just stand on one leg. So just stand there, and if you need to hold on to something lightly, so you can hold on to something lightly, but just check your balance. See what it feels like to stand on one leg and hold it for a second or two. Put your leg down, check the other leg. Stand on one leg, hold it for a second or two, and down. Do that one more time, get a sense of the balance on one leg versus the balance on the other leg, okay? Now, here's what I want you to do, is you're going to breathe like we did. So I want you now to take 3 breaths. So grab your strap again, wrap it around your rib cage, and let's do those 3 breaths again, okay? So breathe in through your nose, and pause. Breathe out. Try to breathe out through your nose. If you can, breathe out through lightly pursed lips. If you can't, do it through your nose. Breathe in. Breathe out. And one more time, breathe in. And pause, and breathe out. And pause, okay? Now, let go of the strap. The next thing we're going to add to this is we're going to do a hinge. Watch what Debbie does. You see she gets a nice long spine, and she just hinges forward in her chair. So if your chair has rolling wheels on it, this may not work as easily. It's better on a chair that's flat or a bench that doesn't move. So she's on a flat bench. You see her hinging, keeping her neck long, and now she'll hinge to stand. And she maintains her alignment of her head, neck, as well as her pelvis. She's got that very nice hinge as she sits to stand. We have her seat elevated up so she's not dropping her hips down too low. So I want to pause this and let's do this together. So hopefully you're in a chair that doesn't have wheels on it, or if you are, just sit at the very edge of your chair, put your feet on the floor. I want you to put your hands on your pelvis like this. So put your hands around your pelvis like this. Sit down on your sit bones. I want you to hinge forward. Let me lower this down. I want you to hinge forward. Oops, let me angle this a little bit more. I want you to hinge forward and slowly come back. I want you to breathe in, breathe out, hinge forward. Breathe in, breathe out, hinge forward. Try to move your hips, not your back. Breathe in, breathe out, hinge forward. And do it one more time. Breathe in, breathe out, hinge forward. Now, if you do not have knee pain, I want you to breathe in, breathe out, and then put your weight on your feet and stand up. And then reverse it to come back down. Stick your butt behind you. That's why it's called behind. You're behind. It should be behind you, not in front of you. Hinge, come up, and then come back down. If you have knee pain, just keep hinging. Breathe in, breathe out, stand up. And then put your butt back. You're behind you. Go 2 more. Breathe in, breathe out, stand up. Breathe in, breathe out, stand up, or just keep hinging, and then relax. And here's what I want you to do now. I want you to stand up and recheck your balance. So stand up again. If you need to hold a wall lightly, you can do that. Otherwise, just check your single leg stance, standing on one leg. See how your balance is. Check the other leg. Just see if it's any better. It doesn't need to be perfect, but do you notice a difference by doing those 3 breaths and those 5 repetitions of your hip hinge or your squat? Because this, as I mentioned, your balance is a result of your posture and your breathing. And using, the third thing that makes your balance better is using your hips and lower legs appropriately. So balance is all about posture, breathing, and using your hips and lower extremities appropriately. And that's the routine we take a lot of our clients through to help improve posture, balance, and breathing. Any questions with that, Jackie?
Nope, we're good. I think
Okay,
good.
We're just about done. Now, we need to challenge our balance in a variety of positions as well. It's not just about keeping everything nice and static. We also need to challenge in dynamic positions. So Debbie, I'm teaching her again. I'm encouraging her how to keep that nice long spine position. She's gonna put her foot on.
Donna said, oh my God, it worked.
Ah, nice. And we find that almost every single time people feel different. It's crazy, but you just need to find something like a balance test to just test before and after. You're like, oh my God, it actually works. It does work.
It does work.
Now we're going to just challenge our client. So now it's the same concept. We're going to challenge Debbie's balance and ability to hold her posture. She's going to step onto an uneven surface. And again, for a lot of us, this may be easy. You know, for me, this would be very easy. But for Debbie, it's not easy. Like she's like, oh my God, I'm exhausted after doing this. I'm encouraging her to be long and still breathe into her rib cage as her leg is wobbling. So this is very, very hard for her to maintain this position and hold it and breathe. So she's basically I'll do that one more time. Show it one more time. So long spine, again, same thing we just did, sitting in the chair. Step forward, put your foot on the balance pad. Keep your weight on the forward leg. Keep your hip, knee, ankle, and foot in a straight line. And just keep breathing into the rib cage while in this position, challenging your balance. And again, very challenging for Debbie to do this.
Yeah, because I think for people that are balance challenged, whether it's balance challenged due to neuropathy or maybe just in general from unoptimal breathing, spinal stenosis, any of that kind of thing, I think the tendency there is to start gripping down, right? That's the challenge, is staying in that breathing position and not tightening and gripping all of the other muscles, right?
Correct.
Cool.
Yep, exactly. And now for Debbie, we just give her an additional challenge, because one of the things that also benefits brain health, we talked about how breathing impacts brain health. The other thing that impacts brain health and keeps your brain healthy is what's called or referred to as dual tasking, doing 2 things at the same time. Most individuals fall when they're dual tasking. They're walking and trying to carry a glass of water, or turn and, maybe they're carrying a bag of groceries. They're doing two tasks at one hand. So we want to take these concepts, and add balance or stability training with a dual task. So with Debbie, I'm teaching her to keep her neck long, to breathe, to step and catch a ball. So she's concentrating on catching the ball as she's stepping. And if you watch her posture, she's maintaining really good posture. But this is something we worked up to. We did the exercise to the left first for weeks, and then we progressed her to what you're going to see here in a moment. So she's basically keeping a nice long spine. She'll step, control, and catch the ball. So now she's adding a dual task, to balance, to step in balance, and then catching the ball. So that way she's working on keeping her alignment, still breathing, and also catching the ball. So that's improving her posture, her reaction, her balance, her breathing, and dual tasking for that cognitive piece of her health as well. So there's many different ways to challenge that. Jackie and her team have lots of ways to challenge you that way as well. But first, remember, it's always about progressing appropriately. Control first, then move to dual tasking type of activities like that, okay? So basically, in conclusion, what we talked about is how posture and what we refer to as motor control is basically your brain telling your muscles what to do, reinforces everything you do through resistance training, it reinforces everything you do from balance training, and what you do with cognitive training as well. And all these four things fit together to give you health and longevity. And remember, as I mentioned, it's all about being responsible, taking responsibility for the things that you can control, which is what you put in your mouth, what you think up here, and the things you do with your posture, your movement, and your breathing. And if you're looking for any information, if there are health and fitness professionals that are looking for more information about the Integrative Movement System, you can check out our website at IIHFE.com. This is for health and fitness professionals that work with the older population, work with clients that have pain, work with clients pre and post joint replacements. We're also on Instagram at IIHFE. We've got hundreds of videos on YouTube. Again, these are designed for health and fitness professionals, but many people watch our videos and say, hey, you know what? I actually got a lot of benefit from your videos as well. So I'll open it up to questions. If there's anything else that you have, Jackie, that you want me to address while we're here. We've gone about an hour. I apologize that it probably went a little longer than we expected it to, but you know that once we get talking, it's easy to go for a long time on this topic that I'm so passionate about.
Yeah, you and me both, right? We were kind of joking before we jumped on today that we could talk about this stuff all day long.
Probably all day long, yes.
We could keep you guys all day long. So Carol said, I downloaded the iBreathe app and it is intervals for inhale, hold, exhale, hold. What do you suggest we set these intervals at?
So what you're going to do is set it initially at 1 second pause. So set the pauses at 1 second, set the inhalation at 3 seconds, set the exhalation at 6 seconds. So it's a 3 second inhalation, then a pause, a 1 second pause. So that's 4 seconds. Then it's a 6 second exhalation. So now you're up to 10 seconds, and then another 1 second pause. So that's an 11-second breath. The beauty of that is most clients, most individuals are breathing way too fast. They're breathing 20 or more times per minute. When you use this, the 11-second breath, you taking your 20 breaths per minute and you reduce it to about 6 to 7 breaths per minute. You become more efficient. You become more relaxed. You become more, you've used your oxygen better. You've created more vasodilation or opening of the blood vessels. You've helped your health, your balance, your posture, your movement, and your cognitive health as well. So 1 second pause, 3 second inhalation, 1 second pause, 6 second exhalation is a great way to start.
Perfect. Anybody else?
And hi, Carol.
She said hello back and thank you.
You're welcome.
Okay, I'm not seeing anything else come through.
Cool.
If you guys think of things, I mean, I do this all the time, right? I watch something, I step away, I'm doing something at home, and then I think about something I just heard or learned, and it generates a question. Don't hesitate to reach out to me. And if I don't have the answer, which I most likely don't. I do. I have a lot of answers,
Yeah,
but
a lot of
might
answers.
not. I'll definitely get back in touch with Dr. Osar and we'll get those questions answered for you.
Perfect.
So lots of great information there today, my friend. I really appreciate you taking time out of your Saturday morning to
Absolutely.
join me.
Always a pleasure.
And I look forward to seeing you again real soon.
Awesome. Thank you so much, Jackie. Thank you for everybody that was on and listening and or watching the replay of this presentation.
Awesome. Have a great day, my friend.
Thank you. You too. Be good.
All right. Bye-bye.